Good morning. I'm here today with Dr. Thomas Lodi, who trains as a medical doctor and as a psychologist and a homeopath. His background even includes a spell as head of surgery. Thomas also went on to found a clinic in Arizona called An Oasis of Healing and is certified in all manner of alternative treatments from IPT to IVC. For those who want to contact Dr. Lodi, you can do it at An Oasis of Healing and also at Oasis International. We'll put details at the end of this. But welcome, Dr. Thomas Lodi, to the Sunday Show. Just for your information, we see the Sunday Show as providing information and tips that listeners can use to increase their personal odds of healing and beating cancer. People who register to listen can ask a question. And so actually what you're going to get is a lot of questions from people who have sent them in to you. But I'm going to start off. Good morning.
Morning.
Having read about you and met you a few times, your approach seems very similar to mine. You're more of a scientist than a doctor, and you're more about rebuilding someone's health than actually treating an illness. Is that fair?
Yeah, in one way, except that I hate the word science, but...
Hate the word science?
Yeah, I hate the word science, so I wouldn't want to be one of them. Even though I mean, everything I do has to make sense scientifically. I have to have some scientific validation. But on the other hand, when science deviates at all from nature, I don't like it. So that's my ultimate reference and standard is nature.
So nature's your driving force?
Yeah.
I read somewhere that you said that health is our greatest treasure. Is that correct?
Oh, yes. Yeah. To be guarded more than gold.
And I read the quote on your Arizona page that surgeons sew up wounds, but health closes them. Mm-hmm. But you were in charge of surgery at one of the hospitals. What initially took you then out of that field into health and healing?
Well, yeah. Never. What left me out? I left the whole allopathic medical field because the paradigm is a false paradigm. The medical model is based on the disease model, and diseases are, the whole idea of a disease is a myth. It's not dissimilar from primitive thinking, whereas something possesses you and gets inside of you, and you need to get rid of it. So you go to the shaman, and he gives you a concoction, and you take this concoction and it gets out of you, or you go to the priest and you get an exorcism or some other way to get this entity out of you. Well, there's no entity in you. There's no thing in you called diabetes. It's not to be located. You couldn't find it in your shirt sleeve, or just below your belly button. You don't have hypertension somewhere. There's no thing in there. What is happening is, and always happens, is that our body is always adapting to an unfavorable situation, an unnatural situation. You see, health is the consequence when when all of our biological requirements are being met. When they're all being met, the result is exuberant health. That's how we were designed. That's how elephants, horses, wild animals are in exuberant health. But when they're not met, and our body has to adapt, whether it's biochemically or physiologically in one way or another, those adaptations we call disease. So I'm eating too much bread, pasta, potatoes, cake, rice, or any combination of it, and there's therefore too much too much sugar around my cells in my extracellular fluid. So my cells, having the wisdom of nature, become insulin resistant because they know that too much sugar will kill them. If they get too much glucose in, they die. So they become insulin resistant. I go to a doctor, he says, you have a disease, it's early diabetes. So what do I need? I need a drug? I need a shot? No, I need to stop eating pasta, bread, potatoes, cake, rice.
Absolutely,
like
yeah.
Okay,
Was there a eureka moment, or is it something you just move slowly into?
What's that?
Well, I mean...
No, oddly enough, I knew about it before I went to medical school, somehow wound up in medical school, and I put it on hold for the time being, and then I practiced for about 10 years as a conventional doctor. And one day I just said, what am I doing? And I went back to what I knew. Yeah. So it was
Yeah.
a re-Eureka movement.
It's one thing I noticed on the Oasis of Healing website. You talk about the importance of a vegetarian diet. Are you yourself vegetarian?
Yeah.
And why is it important? Is it a biochemical view or a moral view or both?
Well, no. Well, yeah. It's just you know, every organism was designed to perform a certain set of functions, and a major portion of those functions is what it eats, because everything is an energy exchange, right? So every organism eats what it eats. It's designed to eat it by its anatomy and physiology, right? So if you have a really long nose and you're near an anthole, you're going to eat ants. I mean, you're designed to do that, okay? If you have wings, you're probably going to fly. So anatomy and physiology, form and function. Anyway, our anatomy and physiology is such that we were designed for plants. If a human took their clothes off and went into the jungle without any weapons, without any tools, without any accessories, it would be very difficult to kill animals. You'd pick up maybe if you caught a squirrel and strangled it, you might be able to get away with that one, or a few snakes here and there, but maybe a rabbit if you could catch it. But without tools, we're not designed. Okay, lions don't need any tools. Dogs don't need any tools. Vultures don't need any tools. We need tools. We weren't designed. Okay, so the other thing is our inside anatomy and physiology. If we look at animals that eat animals, their jaws only move vertically. Dogs, cats, and all of their families. They move vertically. They have no cheeks, right? They have no cheeks. That's why when the dog's chewing, something falls out. They have to pick it up again. They have no cheeks. They're only vertical. All their teeth are sharp. Their tongues are thin. Their digestive tracts are short and straight. Their saliva is very acidic. They have a lot of uricase in their liver to break down uric acid. I mean, they're designed for it. And their claws, they can hurt you, okay? We slap an animal to death? Choking. Anyway, so we're not. And anyway, you look at a horse, you look at all the animals that are non-dog, non-cat. Their jaws move horizontally as well as vertically. Full cheeks, flat teeth, okay? And our digestive tracts are 10 meters. I'm 10 meters. That's pretty long, right? We don't make a lot of uricase. We don't break down uric acid very easily, so we get gout, et cetera, et cetera, et cetera. So that's the anatomy and physiology of it all. So we're just not designed for it. We don't have to be 100% vegetarian at all, because even chimps, you'll see chimps will eat meat once in a while. Gorillas will but not a lot. It's a small part of their diet, but the vast majority should be vegetables and plants. And
so you don't believe in metabolic typing then?
No. Because listen, you mean
well, there was this whole school of metabolic typing. I still get patients come to me and they start talking about what they can eat and what they can't eat because they've been metabolically typed. And so some people are meat eaters and some people are vegetarians.
You mean, is that the blood grouping? You mean the blood grouping?
Well, there was a sort of school of metabolic typing. Came up after William Kelly, the dentist who beat his wife's breast cancer, and then got in the Gonzalez and Linda Isaac's team in New York, and they used metabolic typing to look at how people's biochemistry works, and they concluded that some people are meat eaters, and they concluded other people should go through a piece of meat.
But that was I don't know if that's the same as the guy from Arizona. What was his name? Who said the blood types? If you're blood type O, then you have to be a meat eater, and if you're blood type A.
That's it. I can't remember his name either. We're having an aging fit.
Right, but we know that even animals have different blood types, so they're not, and some horses don't eat hamburgers, and other horses eat hay. All horses eat hay, right? And this whole idea, see, humans we always think we're special, and we always think we're different, and I'm not like you, and you're not. It's nonsense. If you take anatomy class, and we each had a cadaver, two of us on a cadaver. Well, when we took the test every week, right? They gave you 1 minute per cadaver, and I guess what? We're all the same. We all have the exact same anatomy, maybe a slight millimeter variation. So when you peel away the skin and get rid of that personality, we are the same. Metabolically, we're the same. Anatomically, physiologically, we are the same. That's why we can do all the things we do. So, I mean, the idea that we're different celebrities and all that, I object to. So, but anyway, humans are humans, right?
Yeah. Yeah. You also talk about, I noticed on your an Oasis of Healing website, about actually it's equally important not to eat. So you're keen on fasting?
Right, right. And that's absolutely. So just like we have a sun and we have day and night, right? Everything is in polar opposites, and they're both like, what's more important, day or nighttime? It's crazy. It's crazy. It's a crazy thought. It's the time that we're not eating that we are able to process and assimilate and process what we were eating. If you can envision your cells as either dealing with the influx of nutrients or cleaning house, is what they do. You're either dealing with food coming in, or if you're not, you're cleaning house. So people that are eating several times a day never give their GI system a break. So and especially if you go to bed if you eat just before you go to sleep, then the problem is you won't hardly get any time of autophagy. Now, autophagy kicks in when there's no longer any glucose being absorbed going into your cells. Now, remember, even whether you're asleep or awake or whatever you're doing, each cell needs to maintain minus 56 kilojoules per mole of energy. And in order to do that, it has to grab oxygen and glucose and process it, okay? So if you've stopped eating, you haven't stopped breathing, so you're still getting the oxygen, but you've stopped eating, now your cells still need to get that glucose. Where are they gonna get it? Well, they're gonna start recycling all of the intracellular organelles. So they recycle the old mitochondria, they recycle all these things. And that's one of the most important aspects of sleeping. In fact, it's once our mitochondria, which are the little organelles in the cell that produce energy, once the old worn out ones that have been working all day, once they get recycled and eaten up, new ones are born. So you wake up in the morning full of energy. You crawled into bed exhausted and you woke up with energy because you have new mitochondria. They got born overnight. But you have to have that autophagy. You have to be able to clean house. So when you're eating, your body is busy processing. You need to not eat. And so fasting, what we call fasting, is hardwired into nature. No animal finds food every day. They might eat for 2 or 3 days and then not eat for a week.
I agree.
It's just kind of hardwired. And it's not because God is cruel. It's because it's better for health. It's the not eating that allows you to clean house, I have people that come to us for fasting. I have a guy today who's on day 41. He came in a little overweight, not tremendously, but his tongue is still not pink. So those are prolonged fasts, and I'm not talking about that. But just to let you know, because most people say, what do you mean not eat? You mean I have to eat? Yeah, you have to eat, but you have to not eat as often, and when you do eat, you have to change your frequency. So what we do is we teach people to eat, to fast at least 2 weeks, 4 times a year for cleansing, all right? And then to put 18 hours between your last and first meal every day. So your last meal yesterday at 6 p.m., your first meal today will be at 12 noon. And the reason is that gives your body a chance to not only process everything you ate, clean it out, your gastrointestinal tract cleans, you have better bowel movements, you have more energy, everything kind of gets a chance to reset. But when you're continually feeding the machinery and your body just doesn't have a chance to recuperate, then you're in trouble. You'll age more quickly, and many reasons.
So you're a fan of time-restricted fasting. How long have you been a fan of time-restricted fasting then, as you say, only eating for 8 hours?
Yeah, well, since probably 20, 30 years now.
Yeah.
Because it's just, the 3 meal a day habit is relatively recent in history of humanity, right? And it came about because of the wealthy people. You know, if you think about people, they would probably eat when they woke up, and they'd probably go out working all day, and they'd come home and have a great meal. They might snack a little bit You know, this eating all the time thing that we've developed is just not the way it is. And remember, the difference too is when you're eating food that has been so processed and cooked, there's no nutrition in it. You're going to always be starving, right? But when you eat a nutrient-dense food of really whole foods that came from the earth, you're actually satisfied, and you don't really crave and all that. So again, it has to do with eating. I always look at three things: volume, frequency, and then quality. And actually, volume and frequency are more important than quality.
Yeah.
If you eat a little bit of junk once a day, you're better off than eating a lot of healthy food all day long.
Are you you mentioned you encourage people to fast for 2 weeks. What did you say? 3 times a year?
4 times a year.
4 times a year. So you're also into intermittent fasting as well, Volta Longo scenario as well.
Right. The times that you're not eating are equally as important as the times that you're eating, and so you have to give your body that. Listen, there's a guy I know in Bangkok who is in his 80s now. He looks like he's 40, has the energy of a 40-year-old. And what he did is, ever since he was 40, he fasted 1 month a year.
Yeah.
30 days. 30 days, just water. Every year. That was his vacation. And the guy, look, he didn't age. He hasn't aged since then. You know, so the fountain of youth, you know, Ponce de Leon didn't have to go on a long trip. It was easy. It's called water.
So do you see fasting for a couple of weeks, 4 times a year as an important part of cancer therapy?
Absolutely. Preventing cancer, yeah. It won't have a chance to grow. Because remember, you know, cancer eats 2 kinds of fuel, glucose and glutamine. Glutamine's an amino acid.
Yeah.
So even when people go on a ketogenic diet, you know, that's great. It doesn't work with all cancers, and it doesn't starve all cancers, and if it does, not completely, because they can convert into full glutamine metabolism. So the only diet in the world that eliminates both glutamine and glucose is H2O, water. Water can do it. So when you go on a water diet, you literally starve the cancer. And whereas the fat in your body will be used for fuel. So all the cells in your body are capable of using fat, and they will use the fat to live. But cancer cells do not have the metabolic equipment, the metabolic machinery to eat fat. So they starve, and the rest of your body doesn't. So it's actually really good. There are times you can't do it. If someone comes in and they're already in an advanced stage 4, and they're already in a condition we call cachexia, then it's too far. You can't fast in those. But prior to that, you could. And so therefore,
we get asked all the time. We get asked all the time. What does a fast mean for you? If someone goes on a 2-week fast, are they only allowed water? Are they allowed green tea? Are they, some green vegetable juices, or just water?
Sure, that's a very good point. And a fast is only water. Is when you limit your intake to water. In other words, you're eating no other substance, nothing with molecules other than water in it. If you go on a juice, what they call a juice fast, but it shouldn't be called a juice fast. It should be called the juice feast. Because really, if you ever looked at when's the amount of vegetables required for 1 liter of juice, it's an armful of vegetables. All you've done is remove the cellulose, remove the fiber, but you've got all of the other. You got the liquid portion of it. So 1 liter is an armful of vegetables. So you're actually getting more nutrition in that 1 liter than the average person gets in 6 months. So it's a highly nutritious meal. It's a liquid meal. It's a liquid diet. So even teas are a liquid diet. There's some form of food substance, but in a liquefied form. So we look at liquid versus solid eating, and then there's water. So water is the only true fast, and then everything else. So people that say I can't do a water fast for whatever reason, then sure, do a liquid, do a green juice, healthy vegetables, and that you can actually go to work. I did 30 days on juices while working, really busy and all that. So I had to drink a little salt water once in a while. You get some Himalayan salt, and just to keep your electrolytes. Otherwise, you get kind of spaced out. But Yeah. So that's what I call, that's a liquid diet, liquid food versus water.
Yeah, Longo, I mean, there's a huge confusion out there, I find, because McCullough, God bless him, actually confused the hell out of the world, because he was talking about time restricted fasting, but he called it intermittent fasting. Then said
Right.
Walter Longo likes it, which Walter Longo doesn't like it. Walter Longo sides with you, and you know, it's 3 and 5 day fast or 2 week fasting, because that's when it all shuts down. And the number of people I found got totally confused by all this. It was unbelievable.
Well, that's a good point there. I think it's a real problem to call it eating once a day a fast. To say intermittent, because if you say I'm intermittent fasting because I eat once a day or twice a day, that would be like saying, okay, well, I just eat breakfast, lunch, and dinner, but I do fast between them. So therefore, is that intermittent fasting? I fast between breakfast and lunch, and then I fast between lunch and dinner. So am I intermittent fasting? No. So the way I define a fast is when you have not eaten any food for 24 hours. Now you've done a fast. That's one day you've done a fast.
I've got a question from Dr. Dana Flavin, who claims to know you.
Hey, I know
her. She's on our medical board. She said, how do you raise the immune system of your patients? What do you do? Is there anything particular you do?
Well, yeah, there's many things I do. Here at the center, we do, first of all, we measure their immune function. We've got a great lab, Japanese lab, where we look at gamma interferon production. We do lymphocyte subsets, and we take a look at all the different lymphocytes, what they are, all the T cells and B cells and all that, and the gamma interferon for natural killer cells. And we can determine kind of where they're at. The things that we have found that help really good, I have a whole sequence of things we do. First of all, meditation, colon cleansing, and proper sleep and diet, and all those non-medical things are necessary. But the things that we found medically that work really well are low-dose IL-2. We do 3 million units subcutaneously, 6 days a week for a minimum of 4 weeks. And then we watch the lymphocyte subsets, and once we see things starting to get activated, because low doses of IL-2 will do that, will activate a lot of the
Do you want to just explain IL-2, because some of the listeners might not know?
Yeah, I'm sorry. IL-2 is an interleukin. It's a cytokine, and a cytokine just means it's a chemical produced by one cell that wants to communicate to another cell. So IL-2 is part of. It's a chemical that's produced by white blood cells to recruit other cells and to wake up cells and to activate them. So it's part of. In fact, it's part of the febrile response. You know, when you get a fever, you don't get a fever because you have a Tylenol deficiency. You get a fever because your immune system functions best at like 39.5. So it's activating everything. And part of that febrile response includes these interleukins being produced. So we give IL-2, and probably around day 10 to 14, we find that we've activated things. So then we would add in GC-MOF, which is.
Yeah, I was going to ask you, you use GC-MAF, do you?
Right. But only then, because we don't want the macrophages to be the M2. You know, macrophages can be M1 and M2. You don't want them to be in a chronic state, because if you give GC-MOF at that point, you're going to help them help the cancer cells proliferate. You know, you need to get them into an acute phase. You want to get people back into an acute phagocytic and antigen presenting phase. So we do that. The other thing is, if we were able to get a piece of tumor, we would have done dendritic cells at this point as well. And the third thing, so we would add in the dendritic cells at that point with the GC-MOF after the IL-2 has been on for a couple weeks. And then the last thing we would do is, if the gamma interferon was low enough and we thought that the natural killer cells were really inactivated, we have a lab that will take the NK cells out, take them in the lab, they activate them in vitro with IL-2. Once they are activated they multiply them in a nutrient media, and then we give the patient back their own natural killer cells activated, 10 billion with each infusion every 2 weeks. And usually that does it. But here's what I've discovered about the immune system. I'm sure everybody that works with cancer understands this, that the immune system is a slave to the mind. Okay, so if someone gets a big infusion of their own healthy, vibrant, activated natural killer cells, and they're depressed, or they're angry, or they're fearful, within 24 hours they're gone. They're inactivated. So you can't just do this as a physical thing. So we actually have a guy here at our center who is lived with the Dalai Lama for 15 years. He's a British. He's from London, actually, originally. He's lived with them for 15 years. And he was an ordained monk in India and then in Thailand. But he's with us, and he works with people and helps them to take care of their adversary up here. And that's very important, because if you don't change that, even if you have a clean PET scan, it'll be back 100% of the time. So, yeah, but those are the physical things we do.
I think it's really interesting, because for me, you're doing a good job of telling all the listeners that you are a scientist. That's point one. But point two, dendritic cell therapy is quite an interesting one for me, because at the same time my daughter was ill, Dr. Henry Friedman, brain tumor guy in Tufts, in Dukes, he actually gave another patient dendritic cell therapy. In those days, it only worked at about 8%, 12%, but now the figures coming through are much, much, much higher on dendritic cell therapy, so 27, 28%. And I think, you seem to be ahead of the game. Would you say that was fair, or am I just kind of flattering you?
Well, no, because, and I don't know why other people don't think about this. I'm sure Dana does, because Dana's amazing, the lady that just asked the last question. You can't just say, well, this is good for the immune system, I'm going to give it to the person and that'll take care of it. You have to understand that the immune system is an incredibly complex system. There's different phases of it and all that.
Yep.
So whereas something might work in this phase, it won't work in this phase. So you have to really first assess the situation, do your testing, find out where the deficiencies are and all that. You might have these cells too high, and you don't want to activate them. So you need to first do the assessment. And then what I do is I just wake things up sequentially. Like, I don't want to activate this until I've started that. And it's just, to me, that's just common sense. And that seems to be ahead of the curve for some reason. Because you know what it is? People are usually, especially the scientific world, they're always looking for the thing that's going to do it. There's no the thing. It's everything. You've got to do everything. And just segueing just for a brief second with cancer, you're not going to find a magic bullet, because you can't beat it. Cancer is so clever. You can take the most deadly, poisonous chemotherapy. All the cells in your body will die except the cancer cell. It will become resistant. It's extremely clever, because it was born out of a homeostatic response. It's responding, adapting, and so therefore you can't kill it. It's like if you're a mugger, you make your money mugging people. The last guy in the world you want to mug is the guy that just walked out of Gold's Gym, right? You don't want to mug him. You want to mug the guy that's been sitting at his computer all day and doesn't have any muscles. But anyway, trying to kill cancer is like trying to mug a guy that just came out of Gold's Gym. So the only way to beat cancer is to overwhelm it. That's why I use a multitude of B17, vitamin C, curcumin, artesunate. You just do a variety of things. You change the diet, you clean the colon, you do the meditation, then you do the immune system. You do all of this stuff, and cancer just gets overwhelmed. Because if it's a one-on-one or a two-on-one, it's going to win.
Yeah, I call it doors. I actually try, in my own little modest way, I'm nothing as sophisticated as what you're doing, but in my own little way, I build programs for people. And I talk about doors, and I actually say to some people, you've actually got about 12 doors your cancer is going through right now, and I'm trying to shut them all. And it always makes me laugh. People come along at the end, and I say, is there anything else I can do? And they say, you haven't given me anything to boost my immune system. I say, the whole program boosts your immune system. It's lifestyle. It seems to me, again, I'm going to split hairs with you. I think you are a scientist like I'm a scientist, because it underpins everything you do. And actually, for me, even the rainbow diet is a lifestyle. I mean, my attitude to cancer is no one thing's ever going to beat it. You actually have to build a program, but it's the whole totality of your lifestyle and your mind. I send more and more people to a couple of people I've got who actually heal the mind. And because without it, as you say, the cancer is just going to come back.
It'll come back. And I really see cancer now really is that the tumors are the fruit on the tree and the roots are psychospiritual. I don't know if anyone else has looked at this, but we find not everybody, but a vast majority of the women with left-sided breast cancers had some very significant issues with their mother. And those with right-sided breast cancers with either their husband or their occupation. And the left-sided can be with their mother or their children, their offspring. And it's not always, but so, and I found similar types of issues. I mean, a similar situation, like with pancreatic, there's this thing about control. And anyway, but if you don't take care of that. Mm-hmm.
I totally agree with you. I mean, when we get women with breast cancer, the left side for me is always emotional, and the right side, they're very practical people. That's the start point almost of what the issues are behind it. Let's just move on a bit, and we'll have a big discussion at the end, I think, about some of this. I've got a question from Jill Roberts of Toronto. She said, "Can natural therapies like vitamin C cure cancer? Tell us about your views on intravenous vitamin C, please."
Sure. Just real quickly, I don't think of the word cure because cure implies disease, and I don't think there are diseases. I think the body's adapting. But to answer your question and not be a smartass.
No, I agree with you.
Yeah, but does vitamin C help? Yes, it's amazing. When you look at the data on vitamin C, I mean, it works on 4 or 5 different levels. I mean, at a certain plasma level of vitamin C, it's actually oxidative. It kills it, right? On another level, you can have lower levels. What it does is because vitamin C, dihydroascorbate, which is a product of, it's a metabolic product of vitamin C, is picked up preferentially by cancer cells because they have this special receptor called GLUT1 receptor. They have more of them, so they're picking it up. And what happens is when the cancer cell picks it up, its internal antioxidant enzymes have to be used to reduce it, and so it uses up its own Now, cancer cells, remember, they only have very few antioxidant enzymes. They're not like our cells. They don't have a lot of catalase and a lot of superoxide dismutase. So if you can keep a low level of vitamin C in there getting sucked up by the cancer cells, they have to, because they can't help sucking it up because it goes through the glucose receptor. So they have to reduce it, and it kind of exhausts their abilities to protect themselves, right? And then it works on an epigenetic way as well. There's another epigenetic mechanism, set of mechanisms. So all these several, and then the other thing is, it's also, it downregulates something called hypoxia-inducible factor alpha, which is the central molecular event that allows cancer cells to grow and spread, and vitamin C knocks them down. I mean, I could go on and on and on. We could talk about vitamin C for a long time. So the answer is absolutely yes. If there's only one therapy you can do, right, besides diet and cleansing and all those sorts of meditation, sleeping right, exercise, and being honest, don't lie. Besides all that stuff, vitamin C, I would say actually. And here's what I would do if I had cancer. Other than the fasting, I would like to get, and this is what I'm doing in my clinic now, not to this extreme, is I would, I realized, I looked at plasma levels. We know that 350 to 400 milligrams per deciliter of ascorbate in the plasma is the threshold to overcome all the catalase in the blood to kill, to produce enough peroxide so you kill the cancer cell. So we kind of figured that out. So I checked people's plasma levels, and I found, let's say we give them 100 grams, they're only therapeutic for like 20 minutes. They're only therapeutic at most 20, 30 minutes. You'll check it and they go down, which means if you're going for the pro-oxidant effect of vitamin C and you want to keep it there and you give them 100 grams 3 times a week, you've only given them one full hour of
Yeah.
20 minutes, 20 minutes, and 20 minutes. So what we do is we said, well, let's look at this as if it were not vitamin C, but it was a drug, and we wanted to keep plasma levels. Well, you do a loading dose and then a maintenance dose. So we do a good loading dose of 50 grams, right, in 30 minutes, because that's what we found it takes to get you therapeutic quickly, to get your loading dose, 50 grams in 30 minutes, and then we do 25 grams per hour for 3 or 4 hours, and then it's accumulative. Then you can go down to 15 grams. You got to check. Each person is individual. It depends on the deficit you really have, because we all have what's called subclinical scurvy, chronic subclinical scurvy. But anyway, my idea is this: you get one of those, and they have, I don't know if you've seen them now. They use them for drugs, but they're kind of like these little vacuum squeezed plastic bottles. So you don't need to hang it up. You could have vitamin C in there. I think they last 5 or 6 hours.
Yeah.
If you could give someone a loading dose, get them all, and then keep them therapeutic for 1 week, 168 hours of 400 milligrams per deciliter of ascorbate in the blood. What would happen? Or 2 weeks or a month? What would happen? I would love to keep someone on a continuous and see what happens. I mean, I have so much.
They do it with 5-FU. They actually give people a IV all one day. This is a dreadful drug approved in 1956. Right. And then they give you a hip pouch and you go around with it for a couple of days afterwards.
Well, that's how you could do it then, yeah.
Yeah, that's what they do. I mean, the only problem is they forget to test people for their DPD levels, and a number of people are getting really ill with 5-FU these days. I was reading, about Riordan talking about IVC, and he said that he didn't think, even though they loaded people, about 30, this was a few years ago, about 30% of people, their plasma vitamin C just didn't come up. Is that right? Or do you think everybody you can get their level up?
No, you can't. And here's what's happening. It's like remember, the reason it's a vitamin to us is because we're supposed to be getting it in our diet. So when we look at our cousins in the jungle, they're eating 20, 30 times more fresh vegetables and fruits a day, right? And the fruit bat, of course, is another one, the guinea pigs. So the animals that are getting enough, they're having, because when you look at ascorbate, it's across all species. It's a fundamental, essential reducing molecule that's necessary for life to exist. It's necessary. So we're supposed to get it. So we're just not eating enough. So we're walking around with not enough. So for example, when the FDA says you need 50 milligrams a day, yeah, that's enough not to get end stage scurvy. That's all that is. It's not enough for optimal functioning. Okay. So anyway, we're walking around with different degrees of deficits, so that's my take on that. But what I mean is, I have found people that Riordan found. I don't know if they ever did this, but I have found that if I have people, I have them get 10 grams a day. We have a powder. We put it in a juice, and they sip on it throughout the day. So they're getting orally about 10 grams, but they're doing it slowly so it all gets absorbed, so that you get this oral uptake every day, 7 days a week, just so you can get your ascorbate levels up, your functional, physiological, natural ascorbate levels up. Then when we give the IV, I find them that they get therapeutic much more quickly. And then also, some people 50 grams in 30 minutes, some people 50 grams in 45 minutes. It depends. But you can get anyone up there. Absolutely. You just have to do it quickly enough.
Yeah, I was reading that it's anything between 0.1 and a gram per kilo of body weight, but surely that's a bit old-fashioned, isn't it?
That was the old, right. But that's maintenance. That's maintenance. You have to, once you get them up, then 25 grams an hour can keep them there.
Yeah.
In fact, if you stay.
So how long do you like to have someone? If you're going to give someone IBC and you really want it to work, how long do you want someone in your clinic?
Depends on how advanced the cancer is. If they've got it in a stage 3, stage 4, other organs, it depends. If they're really sick, if they're not that sick, but I would say anywhere from minimum of 6 weeks to 12.
Yeah. Did it work with all cancers?
Yes.
I mean, Iowa, I was looking at the research from Iowa and Kansas State, and they've been using grade 4 brain tumors and grade 4 lung cancers, and they've got good results. In they've finished phase 2 clinical trial. They're going on to phase 3 now.
With vitamin C?
Yeah, with IVC. I can send you it if you want. No problem.
Yeah.
Yeah. Okay. All right. Well, I've got a question. This came from about 4 people, and Robert Heath asked this regularly. He said, how would encourage someone on orthodox medicine to consider other healing modalities? Is it possible? Will they do it? And
Well,
he was a carer. He was a carer for his wife, and she just wouldn't budge. Much to his chagrin.
Well, what I'm doing now, there's a doctor that I work with in Arizona. He's running my clinic in Arizona now because I'm here in Thailand. Dr. Nathan Goodyear, and he and I have started a series of podcasts called The True Second Opinion. We haven't launched it yet. We wanted to get enough built up. And what we're doing is presenting all the evidence on each. So in other words, chemo. What is it? What is it? How does it work? Let's look at it. Does it do any harm, et cetera, like that. So we're just going to give the evidence. So, and the reason we're calling it the true second opinion is because of this. If you go to get an opinion at, let's say you go to MD Anderson, and then you go to Dana-Farber, and then you go to Sloan Kettering. Well, you've gotten 3 first opinions. Because it's like if you're going to buy a car, you don't go to a Toyota dealer in Bangkok, a Toyota dealer in Chiang Mai, and a Toyota dealer in Phuket. Each one, you might get a Corolla, you might get another one, but you're all going to get a Toyota. That's the thing. So to get a true second opinion, you need someone from a different paradigm that'll give you a true second opinion. So what we're going to do is we're going to talk about chemo. That's several different podcasts. And we're presenting peer-reviewed studies. We're looking at all the studies and exactly what it is. And then we're doing the same with radiation, with surgery, and with vitamin C, and with artesunate. And you wouldn't believe that I think there are something like, 14,000 peer-reviewed studies on vitamin C. No, 144,000 peer-reviewed studies on PubMed with vitamin C. Okay, these are in peer-reviewed studies. So when your doctor tells you that there's no evidence, it tells you 2 things. One of 2 things. He's either lying, or he doesn't read. He goes home and watches TV. If he was reading, then he would know. Everybody knows about it. We know how about artesunate? The only reason artesunate is now getting any credibility is because it was approved for malaria. Right? So now now they're doing research on it. But the point is, what I would do if someone is stuck in orthodoxy is just give them the data, give them the research, say, look, and they should be open to that. So, but that's the reason we're doing this second opinion podcast. And we're going to have people on after a while. But first we want to just present the real, because if you knew what chemo did, what I have found out by doing this research, Dr. Goodyear has found out.
It's awful. I did a speech. I had about 100 oncologists in the room, and it actually upsets me when patients say to their oncologist, I've changed my diet or something, and the oncologist says, well, there's no point. It doesn't do any difference. There's no research on it, and that really, really annoys me. Or they say, can I change my diet? Would it help? And he says no, and they just say, there's no research in it. Non-stop now in Britain. I've never heard that. The new answer in Britain is I've never heard that. So if you dare to say that well, I'm not eating sugar anymore because it, feeds cancer. They just say now, I've never heard that before. They've changed their whole argument against.
Okay, really, wow.
Yes, unbelievable. I had about 100 oncologists in the room, and I said, when I was, because I had another life, when I was chairman of an ad agency, I said, a client would ask an account director a question, and the account director would give a totally wrong answer, because it was off, otherwise they look stupid, won't they? And I would take the account director out of the room afterwards, and I'd say, don't ever do that again. Don't ever do that again. If a client asks you a question, what you say is, I'm really sorry, I don't know the answer, and I'll give you the answer on Monday morning. I'll go away and find out, and I'll give you the answer on Monday morning. And actually, you will not lose face. The client will think you're wonderful, and because you ring on Monday morning, he thinks you've done something extra special for him. And I said, what is it with you doctors that you've got someone's life in your hands,
Exactly.
and you will actually do what we call in advertising bullshit.
Exactly.
It is bullshit.
Exactly.
You're giving a completely false answer and putting that patient's life at risk. Because we've got loads of research now on diet and exercise and whatever, making a big difference with cancer. Loads of it. That's
No, exactly. No, exactly. It's not, and you know, if you're not wearing a white coat, it's called a lie.
Yes.
You lied.
Yeah.
You lied.
Yeah.
But if you're wearing a white coat, it's a medical opinion. You know, but you know, here's the thing. How do you explain PET scans?
Yes.
I mean, how do you explain a PET scan? You know, and for the, you know, and I'm sure even the non-medical people that are listening know that a PET scan is they inject you with radioactive glucose. They wait a while. They give you an hour to wait till the cells pick it up. Then they do a special scan, and whichever cells are picking the sugar up, the glucose up, the quickest, they can tell our cancer if it's above a certain rate. I mean,
yeah.
So anyway,
Fiona Shakila Burns is a great buddy of mine. She actually asked a question. She said, do you think there's ever a case for systemic chemotherapy?
Well, yes, there's situations where I've had, if I have, and there's also cases for surgery under certain circumstances, and even radiation, and they're very rare, but they're very specific. So let me start with the surgery. Surgery, and sometimes this is with chemo as well, if it's inoperable. If the tumor is blocking a vital function, you know, and we've got to move quickly, otherwise you're dead. Like you can't breathe, you can't eat, you can't have bowel movements. We don't have the luxury of time, so we have to do something. And if it's surgically inoperable, if you can't, you know, remove it, if you can do something with chemo, then I would blast it with chemo. But I don't do high dose systemic. Throw a hand grenade at it. What I use is insulin potentiated chemo. And what the little bit of data there is clinically with IPT, it's not a lot, because big pharma won't support it. But we actually find out that with IPT, you use a 10% dose with the insulin, you actually get a higher concentration of the chemo in this tumor than you would had you given a full dose without the insulin. And the reason is the insulin door, when you open up the insulin door, this is a door that is a survival mechanism for the cancer. So it can never become resistant to it. I had when I was back in New York, I used to have oncologists, when they tried all their different protocols and it failed, they'd say, go see this guy. I don't know what he does, but it works. They would come. I would take the last protocol they were on that failed and give a 10% dose with insulin, and it worked. Because, you know, becoming resistant to a chemo just means that the cancer cell is now able to push the drug out faster than it can get in and do its damage. So that, you know, these multi-drug resistant genes are able to push it out. So what you're doing is you're going through another doorway that it can't, that gets it in quickly. So anyway, those are the times I would use it. The other conditions besides blocking a vital function are excruciatingly painful, right? And simply too big. You know, sometimes they're just too big. There's no way, and so the burden is putting on your immune system and your whole body is just be better off to get that out of there. And I've had people come in with, you know, 1-2 kilogram tumors, so you know they can get pretty big. And those are, but I would never give just a high dose blast them, because you're going to blast everything. There's no reason, even if you want to give high dose, at least potentiate it with insulin so you can get it.
We had Fiona on the other week, and Fiona actually beat her cancer without any treatment at all. And at one point she had a brain tumor and it was all over her ovaries, and they wanted to operate and give her 8 weeks, I think she gave her at one point. That's a different story. So we know Fiona very well, and we know her views against chemo. I had a question from Sheila Clark, which just takes us into what you've just been talking about, IPT. What we ought to do for the listeners is just explain IPT. IPT, and you and I have had this discussion about the use of IPT. IPT, you can use up to what, 5 or 6 drugs, but you only take 5 or 10% of those drugs at the same time. And you use it with insulin, but you've starved people for 48 hours beforehand, haven't you, to switch off the healthy cells. So they're all quiet and calmed down. And now you put the insulin in with the drugs. Is that correct? And And basically, cancer cells have got 14 times the insulin receptors. So, as you say, the door's open and the insulin takes the drugs in. Is that right, or have I got something wrong?
Well, yeah, actually, so the cancer cells have, yes, approximately 15 times more insulin receptors, because why? They need more glucose, right? Because they're very inefficient. Cancer cells are only fermenting. They don't have oxidative phosphorylation, blah, blah, blah. So one molecule of glucose only produces 2 energy packages called ATP, whereas a normal cell, one molecule of glucose makes 38. So the cancer cell is 19 times less efficient at energy production. Therefore, it needs 19 times more glucose, or 19 times more fuel. So it upregulates certain enzymes like beta glucosidase, so it can grab glucose. And it upregulates the number of insulin receptors. The other thing about these insulin receptors on cancer cells is that they have a 70% higher affinity for insulin. So in other words, they're more likely to stick, and they are resistant to downregulation. So even though you've changed their diet and the rest of your cells are becoming are changing their insulin resistance, cancer cells don't. They stay the same. So anyway, so you come in, you don't have to, classically it's practiced by the person just ate last night. They can stop eating last night. Now you're right, I think because of Longo's study, anybody who's ever going to get chemo should always fast 48 hours or at least 24 hours before they get it, and the day of. But we only, just as long as you come in fasting, you haven't eaten all night in at least 12 hours, then you get a small amount of insulin, 0.4 units per kilogram of body weight, okay? Unless you're extremely thin, right? Or you're a type 1 diabetic, there's another variant, but that's the average. And that is usually the amount of insulin. It's not a big dose. It's the amount that you would normally secrete during an average meal of a normal, healthy person. So you're not getting a lot of it. And then, so what happens is this: the cancer cells, because they have more receptors with a higher affinity for insulin, they grab that insulin first. Now, one of the things that insulin does when it binds to an insulin receptor, it does many, many things. It activates all sorts of pathways. But one of the things it does is it stimulates an enzyme called delta-9 desaturase. And delta-9 desaturase, see, in all of our cell membranes, we have a lot of a particular fatty acid called stearic acid. Okay, so delta-9 desaturase makes the 9 position of stearic acid turn into a double bond, which is now it's turned into oleic acid. And oleic acid is olive oil, actually, basically what it is.
That's right.
So the difference between stearic acid and oleic acid, for our purposes, is that the melting point for stearic acid is 68 degrees centigrade. The melting point for oleic acid is 5 degrees centigrade. Now, since body temperature is 37 degrees centigrade, that means at body temperature, if the cells in your if the fatty acids in your cells in your body are stearic acid, they're going to be solid. They're not going to be permeable. You get the insulin, and this is what happens after you eat. Your body makes insulin, and now your cells become permeable, so they're liquid. So that's how it permeates through. That's how it gets in. So here you are. You've given a 10% dose of the chemo to someone who's had the insulin circulating for about 30 minutes. Now you can give it a 10% dose. About 50 or 60% of it goes right into the cancer cell. So the amount that doesn't go into the cancer cell, so let's say 50% goes in and 50% doesn't. So the 50% that doesn't go in, and it goes everywhere else, is a 50% dose of a 10% dose.
Yeah.
So 50% of 10% is 5%. So the side effects are minimal. You don't lose your hair. You get very little bone marrow suppression. Nausea and vomiting is rare. I mean, so that's it. It's kind of like you get the benefits of the chemo without all of the garbage, all the side effects.
One quick question. When you administer the drug and the insulin, would you give sugar?
Never.
Well, that's it. I totally agree with you. Totally agree with you. And yet some German clinics literally make people fast for 24 hours or whatever, and then they give them a shot of sugar before they give them the insulin and the drug. I do not understand that. It's madness as far as I can tell.
It's called Clinique, I think is the name of the Clinique St. George. in Germany. Yeah, I know about the one. And I remember his name. Yeah, I forgot his name. But they
Yeah.
did that. He would bring them in. He would give them like dextrose or glucose. He would get their blood sugar up to 200. Then he would give them insulin. So what you just did is you fed the cancer cells. They're full. They're saying, thank you very much. I don't need anything else.
Yeah, that's right. And you've opened the doors up to all the healthy cells. I think it's unbelievably stupid, but never mind. Would you, let's go to Ruth Curtis in Los Angeles. How important is the mind-body connection, and what techniques do you use to heal the mind, apart from your man from Tibet?
He's got in fact, you should have him on one day. You know, he's an amazing guy. You know, and the beautiful thing about it is because of what he went through this system, but having grown up in the UK, so he's, you know, he speaks English. He can help us understand.
Not guaranteed.
That's not a right. Some of us don't understand him, but he explains it and he works with us culturally and all that. But basically, so how important is it? Well, I'm going to give one example that I think is a really good one. I had a woman who had breast cancer and it had metastasized to her lungs so thoroughly that when I, at some later point when she was there, I did an X-ray. I just wanted to see because she was coughing, and I could find no normal lung. There was none. But she came in. She was on a gurney. She had oxygen on. She was had just come from her doctor, and who told her she had 3 weeks to live. She was advanced stage 4 cancer, and she had seen some of my videos. So when I walked up to the gurney to say hello to her, she grabbed my arm and she said, "Thank God, now I know I'm going to make it." 6 weeks later, she was jogging to the clinic every day, and her husband would drive behind her to make sure she was okay. 6 years later, I got a postcard from Paris. Okay, so what was the difference between her and the lady down in the other room there, who didn't have as severe and is not with us anymore? Because she was full of fear, and this woman, she didn't say, "I think I'm going to make it." She said, "I know I'm going to make it." And what I want to help you understand something about that is, it's the word, and I don't use this in a religious sense. I use this in a philosophical sense. To have faith, faith means you know what's going to happen before it happens, right? You don't believe it. You can only, remember, the way belief, you can only believe in something that's not real, like Santa Claus. You don't believe in mountains. You don't believe in trees. You either know about them or you don't, okay? So now, if you cut your finger while peeling an apple, you don't believe it's going to heal. You know it's going to heal. Well, when you know, like you know your finger is going to heal, and you know this is going to heal, it's healed. So that's faith. You know it's going to happen, and it hasn't happened. And how do you get there? You get there by knowledge. You know, when you understand that this body, what is it? 10 to the 36th power number of chemical reactions every second is going on in this body. We're making 2 to 3 million new cells per second in this body. Okay, so this is a miraculous electric, biomagnetic, amazing thing. Of course it can heal. And that's what it does. It was hardwired and designed to regenerate, rejuvenate, and procreate. That's what it does. You cut it, it heals. So all you've got to do is take away all the things that are antagonistic to that and supply the raw materials that it needs to accomplish what it does, and it heals. Okay? Yep. And the worst thing and the best thing you can ever do if you have cancer is avoid doctors, because they will beat you up psychologically. You know, when they tell you you're going to die in 3 months, they should be, I mean, that's, I consider that terrorism.
I agree. Awful praise on the mind. So let me understand this. Do you also say an Oasis Healing, you do prevention packages? Do you, if someone's had breast cancer and just don't want it to come back, they can come to you and do preventing recurrence packages? Can they not just treatment, or do you really major on treatment?
Mostly treatment, but most people don't come to us after unless they've already been a patient, because all of our patients we have them coming back on a regular basis, just to keep them plugged in. Because a lot of what we, if I had to think of one thing that would distinguish the way we look at it from other places that I've seen around the world, is that it's what I've written is, it's not hard to get rid of cancer. The hard part is keeping it gone. Yeah. Right? And anyone who's had cancer knows that, or anyone that's worked with cancer. I'm on my fourth recurrence or whatever it is. That's because it never really went away. But the thing is, you need to live your life so that you stop making cancer. Because think of it, if you have a tumor in your pancreas and it doesn't grow and it doesn't spread, you'll live a normal life. So when you go, when a person coming to me, they're not really saying, how do I get rid of this? They're saying, how do I stop making this?
Absolutely.
So that's why, that's why we say stop making cancer. That's the number one thing we do. And that involves everything from the way you sleep, your relationships, everything.
How do you help people sleep?
Well, I go through, I have this thing called sleep hygiene. I take them through a program I have where I have them do a mind enema before they go to sleep. And that's basically, you got to turn off all electronics for at least 30, 45 minutes before you go to sleep. And you've got to go to sleep at the latest is 8 o'clock, 9 o'clock, very, very latest. But for 30 to 45 minutes before you sleep, you sit down and you get old school pen and paper. You wrote down everything that you did today and everything you didn't get to today, everything you need to do for sure tomorrow. In other words, you unload your mind, okay? It's called a mind enema. And the things that are like short term, things that you're worried about, you have these different columns. You organize all of those things that we normally just allow to percolate. You put them all down. Now you've emptied your mind. And then you lie down and you have to plug up your ears. So if you're not in a quiet place, you put an eye mask on. The room's got to be cool. Not cold, but cool, because you have to hold a blanket. People need to touch, hug, right? And if you're with someone, don't lie there hugging them, hug them, say goodnight, but then you need to be with yourself like that. And then take melatonin. Melatonin's very, really important, or tryptophan, 5-hydroxytryptophan, but melatonin is good. And, we now know melatonin is probably one of the most potent cancer killers.
Well, I did a speech with Russell Rita about a year ago, and he's now getting people on 60 milligrams 3 times a day. I mean, we've covered anyway that it's got 5 ways of working against cancer.
Right. Oh, yeah. Right. Yeah, it does. No, it's amazing. It's the most potent scavenger of the hydroxyl radical. It's amazing. Yeah.
How can you use it? I got asked this the other day. How can Rita use it? 3 lots of 60 milligrams a day and not send people to sleep for the whole day. I mean, I can't even take more than 5 milligrams at nighttime without being asleep on the golf course the next morning.
I don't know, but Schlesinger, Schlesinger?
Yeah.
What's his name? His first name? Brilliant guy. Oxidative, he's an ozone doctor. Frank Schallenberger. Frank Schallenberger. Yeah, he does, I think, about the same amount. I think they use patches, and it's a slower absorption. I think that might be a way to do it instead of taking 360 milligrams. If you can get a compounding pharmacist to make some sort of patch on it so you could absorb it slowly throughout the day. But that, yeah, I think that might work. But the other thing, keep your ascorbate levels up. Make sure your vitamin D levels are up. And
oxygen. A lot of people are low in oxygen. I have one guy, would you believe, couldn't get out of bed, and he was about 32 years old. He had grade 4 kidney cancer, and his oxygen level was 57. Yeah. No, seriously, I thought next stop death, but we got his oxygen up to 99, and he got out of bed, and he was fine. No doctor had even thought to worry about his oxygen level.
Right. Another thing, when you walk into the room of a sick room, open the window, fresh air. Yeah, so that's exactly what you're saying. The thing is, and that brings me to transfusions. When what's acceptable in hospitals that I find all over the world now is hemoglobin of 8. Now, for a man, a normal hemoglobin is 14, for a woman around 12.5, right? So a hemoglobin of 8 is the same thing as taking half of your blood and throwing it away. Tell me if you'd be tired, right? Now, but they're saying they won't transfuse someone until they're at an 8. Well, even if that were okay for the average person with non-cancer, and it happened over several weeks, so they were not, acutely, they weren't having acute problems, you still have a systemic hypoxia, which is feeding cancer. So I always say you have to have a hemoglobin above 10.5 to 11 at least, so you're not, otherwise you can't carry the oxygen. So you're absolutely right. Oxygen's a big deal.
Yeah. So last question from David Lang in Sydney. He said, how much time do people with cancer normally spend in your clinics, and what's the sort of cost? We won't quote you.
Okay. Yeah. So right now, just to clarify, I'm in Phuket. I'm at a place called the Life Co. And then
I promise you, I'll come and see you.
Huh?
I said, I promise you, I'll come and see you.
Okay. Do. And then in the U.S., it's Oasis of Healing. So when I moved, and I don't own this place in Phuket, I'm just a consultant. But when I moved from the U.S., one of the reasons that I chose Thailand was because I thought that we could provide all the same services and it'd be a lot less expensive. Because in the U.S., paying everybody their fees and paying for the medicine and all that sort of thing and all that, even with a less than 10% profit, the price was around $10,000 US per week, right? So very, very expensive, right? I certainly couldn't afford it. So anyway, I came to Thailand thinking, yay, now we can lower labor costs and all that. And the people I work for, it's about the same. It's still coming out to that same expensive.
I think there's another reason though, isn't there? I mean, I had a patient in Japan, English guy in Japan, in Tokyo. He was on GC Math. His doctors anyway in Japan have prescribed it for him. So there is a kind of a more open-mindedness in this part of the world. Do you not find that to what can work and what won't work?
Exactly. Well, it's interesting in Japan, because I spent some time there. In Japan, you can go into the doctor, you'll walk out with one bag of medicine and one bag of herbs. For them, it's not, they don't think that, they don't separate them. Now, but here, the reason I came here too is because they're very open to, what do you call it? Foreigners coming and who are experts in areas and learning. So it's really great. So the question is, how long were people are here? It depends. I'd say 6, 8, 12 weeks. But it involves now that fee. You got to keep in mind that fee includes everything from food, every therapy, colonics, everything. There's 5. Every morning we're really close to the most beautiful beach. We go down on the beach and we have morning walks on the beach and meditations on the beach. And we have yoga all day long, and there's different types of yoga. There's sound healing. There's a lot of really beautiful things. And there's fresh fruit and there's raw foods. And it's a healing center. And what I want people to understand about that is that when you go to a treatment facility, first of all, you're back in the disease model. They're going to treat you. They're going to fix you. The doctor's going to fix you because you're not smart enough to fix yourself. That's implied, right? And so you sit back passively to be fixed. Okay, well, that's the wrong paradigm because there's nothing wrong with you. Your body, whatever it's doing, if it's insulin resistant, if the blood pressure is high, whatever your body's doing, it's doing it out of necessity to maintain functional integrity. The body didn't make a mistake. It's doing absolutely what's necessary under the circumstances to keep you alive, okay? So there's nothing that needs to be fixed. Really, what we need to do is get out of our own way. Stop eating this, stop doing that, stop doing all this stuff, and wow, there it is. It'll start to recover. But anyway, so the difference between being treated and a healing center. In a healing center, it's your journey, and all that we're going to do is be your guides and your teachers along on your journey. And your journey will last well after you leave here. Okay, so we're just going to get you started, give you some guidance, but it's your journey. And that does another thing too. It gives you back your power. Because otherwise, if you're going to fix me, I'm too stupid. No, you're going to allow yourself to heal. You're going to take the step. You know, it's a paradigm shift that is empowering, and it works. It works.
Do you think theoretically everybody can heal?
Yeah, I do.
Yes, so do
You know,
I.
but
I get people who've written on the form, I'm terminal ovarian. There's no such thing as terminal. It means they've run out of ideas. I haven't run out of ideas.
But the person that can't is the person who says I can't.
Yeah.
If they can't, if you know, and I see that when I see a couple, like a husband and wife, and one or the other is trying to keep the other one alive, when I can see when when the person themselves has given up.
Well, it was the Henry Ford quote, wasn't it? There are those who think they can, there are those who think they can't, and they're both usually right.
Yeah. That's very
Dr.
good.
Thomas Lodi, thank you so much for being on my show. Thank you. It was very, very kind of you, and I'll see you soon in Phuket, I promise.
Okay.
Thank
Fantastic. Thank you.
Bye.
Bye-bye.